Hello, everyone. I'm Gustav Oppermann. I just graduated with my MS in Child Development, and I was studying Universal Design for Learning in elementary school classrooms. And as part of LEND, I was exposed to some more medical settings. And so I took the Universal Design principles and the neural components underlying them and sort of applied them to healthcare settings. So here's the LEND funding disclosure. And so anyway, the problems in healthcare settings and the problems in education are very similar. So they're mostly derived from a deficit model of autism. And when you have a deficit model, you create deficits in your care practices. So what we found in the research is that there are reduced access problems, institutionalized harm for autistic patients, and striking health disparities for autistic individuals. There's a huge mismatch between the need for healthcare services and underuse restrictions in access. So what we were trying to do at the UC PATH, Patient Access to Healthcare is the acronym. Clinic, it's a blood draw clinic, phlebotomy, and what they were doing is trying to really build relationships with the patients and their families in order to make the procedure more feasible. There's lots of problems with getting blood draws from autistic patients, but they need them, right? That's the mismatch. You have people getting medications or surgeries or things like that, and you need to have genetic testing. And so you need to have blood draw. And unfortunately, the medical model wasn't working for them. So rather than relying on, objectified autism, we're trying to recognize the emotional complexity that underlies behavior in autism spectrum, rather than looking at the individual and their behavior as the problem. We're trying to focus on a relational attunement in the healthcare setting to provide the safety and security that they need to fulfill their procedure. And then we're looking as scientists a holistic evaluation that goes beyond did the blood draw happen or did it not, and looks at what was their experience of blood draw like, because we want to encourage them to get services in the future. So here are the outcome measurements. These are the traditional outcome measurements, and you can see that the PATH clinic is doing a great job. So of the blood draws that I observed, almost all of them, I only observed two that failed. And then overall, we have 109 over 119 since 2023. So this is a very successful 93% success rate program. However, when you look at this, you go, well, what's missing here? Well, you could technically get these numbers by holding the patient down or sedating them or any kind of underhanded tactics that actually in the long term would harm the patient. And so what we're trying to do is make a change in the way that we look at these things and use what are called PREMS, patient response experience measures. And so a lot of these kids are nonverbal, and I adapted this tool that we used in my work in UDL, this temperature thermometer here, emotional temperature thermometer here. So from -2 to +2, how did you feel about this procedure? So I asked 4 different questions. They were chosen not at random, but to really get an idea of what the different aspects that they were modifying in the PATH program, how effective they were. So they use a different kind of room. How comfortable was the room? Well, there was some mixed reviews there. So some people thought that it was good. Some people said, I couldn't be bothered by it. Distractors and choices, those had even more mixed reviews. And you can imagine, you're already in a stressful situation and somebody says, well, do you want to watch an iPad? Like maybe that works, but maybe it doesn't. That could be an additional source of stress. choices even. You think, oh, autonomy is always good. Maybe, but, maybe they don't want to choose too many things because it adds more distress for the patient. However, every single one of the patients that I sampled, 100% of the sample, 10 kids, said that the relationship building was the most successful part of getting their procedure done successfully. So I want to go into why this might be the case and really introduce you all to, well, hopefully not introduce, but point out to you that the computer analogy for how the brain works is an outdated and outmoded. Just yesterday I was at the Neuroscience Center looking over an exit presentation for a PhD student who is re-envisioning reinforcement learning through predictive coding. This is something that everybody who works with brain science, mind science should know about. So formerly we had this computer analogy of sensory input goes in, behavior comes out. You are processing the world around you, and that is how it works. However, the Bayesian brain, which is more recent, however, is actually an old idea. Carl Friston, the most recent proponent, points to Hermann von Helmholtz as the first. But actually, if you look back into the research, you see that Ibn al-Haytham in the golden age of Islam was the first to envision this mode of the brain. But in any case, your brain is making these predictions about proprioception, where your body is in space, interoception, what your organs, what your physiology is doing, and exteroception, your external world. It's relating those to the lived experience, and then the difference between the two is where you are stimulated or not. So in the child life coping plan, I want to relook at these things through that lens. We have these pre-appointment email needs. The child life specialist is building a relationship with the parent by doing phone calls, checking on the child's specific needs, looking at their interests, phobias, and what kind of regulation strategies are successful at home. Then we have itinerary sent out. This is the actual itinerary here on the left that shows what the procedure is going to look like visually for the child so that they know, hey, here's how it's going to go. They also provide a social narrative to share with your child so that you can go over it with them. Hey, like this is what you're going to do. And then at the end, you're going to get a prize. When you're looking at this procedure, you're not looking at input and output. You're actually looking at building safety and security. So when you recognize that the brain doesn't just receive sensory input, it actually predicts it and processes the prediction errors. What you're trying to target is not the actual sensations themselves, but their predictability. And crucially, when you're looking at ASD, the world of the ASD mind is more volatile than you would see in a neurotypical. And so because of that, they need more explicit strategies for communicating safety and security. So rather than targeting the sensory system, what you're looking at targeting is the limbic system. So this is an emotional system closely tied with intersubjectivity, your interpersonal relationships with others in your community. So are these sensory issues really sensory? Well, you see that the medical model actually isolates the symptoms of autistic patients as within the individual. So you see, oh, they're too sensitive. They're having their response to this light is too much. But actually, what we're talking about here is that the weight given to their sensory input is variable and it's dependent on the context of the situation. So by modifying the context of healthcare, by making relationships the priority, by making interpersonal attunement a priority, you can actually modulate the pain receptors and decrease the negative behaviors, so-called negative behaviors that they're experiencing.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.